Assalamu alaikum. Hello and welcome to webinar number 5 of the Headache and Migraine Patient webinar series. My name is Gerard Moore and I am the webinar support manager for today. The date is the 19th of October 2020 and it's 7 p.m. here in the UAE. I'd like to welcome you all from wherever you are joining us. If you have any audio or video issues or problems, you can press the red reconnect button located at the top of your screen. Or if you wish to ask me a question privately for admin questions only, you can write the admin only button on the chat bar. The chat bar is now open for any questions or comments for our moderator and our speakers today. Our moderator, as always, is Dr. Ahmed Shatila, consultant neurologist from Sheikh Shakboot Medical City, Abu Dhabi, to give the formal opening. Dr. Ahmed, the floor is yours.
Thank you, Gerard. First of all, good evening, everyone. I would like to thank you all for attending tonight's webinar. With us tonight, we have Dr. Jasem Hachel. He is a consultant neurologist at Ibn Sina Hospital in Kuwait City, Kuwait. He is also the director of the Headache and Botulinum Toxin Clinic in Ibn Sina Hospital. I would like to thank again everyone in the audience for attending this webinar, because without your support, these webinars could not actually happen. I would also like to thank our sponsors, Lily and SSMC for hosting the event, and Gerard from Focus Gulf for organizing the event. So without further ado, Dr. Jasem, the floor is yours.
Well, thank you, Dr. Ahmed, and thank you for taking care of these events, actually, which are very helpful for the people, and it will increase the knowledge of the people. And let me just share my screen now. Okay, do you see my slide now clear? Can I go ahead?
Yes, we see it clear.
Okay, great. So I'm going to talk about what we did here in Kuwait during the past, for example, now almost 7 months or 8 months during this COVID-19 era. الوقت الذي مرينا فيه في هذه الجائحة من الكورونا فيروس COVID-19. ما الذي صنعناه وكيف نتعامل, and how we are dealing with our patient with migraine and different types of the headache. Now, it's very important in احنا نعرف who should be scared. Now, if many people, they got scared from this. So we have many patients, they are scared from going to the hospital because they are afraid that they will counter the infection. Many of them, they prefer to go to a designated clinic or they go to a private clinic, but even the private clinic were locked down. Doctors also were scared because we don't know who is carrying the virus. Not all the patients with coronavirus or COVID-19, they are symptomatic. Now we started to know even kids, they can be asymptomatic. And they can be the index case. يعني ممكن يكون هو الحالة التي أدت إلى الانفection, which is the source of the infection, the whole family, kids. So it was very scary. And we don't know if the patient you are dealing with is really symptomatic or asymptomatic. So any headache case, and as you know that the headache is one of the symptoms of coronavirus, أحد الأعراض. فلذلك we don't know, does this patient really, خاصة لما يكون a new onset headache. Now, we learned many things as a doctors and physician في هذه الجائحة during this pandemic. That telemedicine, إن احنا نتعامل بالفيديو calls أو بالFaceTime. There are many things. WhatsApp even call. It's really easy, and it has been proven أثبتت أنها تفي بالغرض. There are tons of patients who come cross long distance to see a doctor without a need. They can do this, يقدرون يسوون هذا الشيء through a telephone call, and many of them, we realized that many of the patients, they were coming only to collect their medicine. And that's very important that we have to use the time properly. We should not mix cases. We should not mix the cases, and we should differentiate. يجب إن إحنا we differentiate between what is important and what is not important. ما هو المهم الذي يجب أن نعمله؟ ما هو المهم الذي يجب أن نحن نشوف هذا المريض ولا يستطيع أن ينتظر هذا المريض؟ كذلك it's cost effective، يعني توفر فلوس كذلك كثيرة سواء على المريض أو على الدولة. More than 90% of the headache what we see, they are benign headache. ما فيهم أي مشاكل. بالعكس هذه المشاكل، مشاكل الصداع زادت. They have increased. Headache has been increased during this pandemic due to the stress and the lockdown. And people, they changed their routine. They are not eating on a regular basis. They are not sleeping on a regular basis. That increased people's stress and anxiety. And as a consequence, they developed the tension type headache. Tip number 2, social media. And I think it's a very good time for Ministry of Health and people physician. So I have like my own Instagram for a while now. For the past 4 years, I have been using an Instagram. So I started to post more even during this. Actually, interestingly, because of the lockdown, the telecommunication companies here, they started to give free giga actually to the people. So people actually, they started to use social media even more. So if you don't use the social media in the right way, people, they can use it in the wrong way. If you don't volunteer as a physician, and if the Ministry of Health doesn't work, other people, they will give wrong information to the people. So social media is important. And we have learned during the pandemic. تعلمنا ان السوشيال ميديا استخدامها الحسن او استخدامها بطريقه فعاله لبث المعلومات ونشر المعلومات الصحيحه قد يكون جدا مفيد لكثير من الناس وتوعيتهم. ما هي انواع الصداع؟ ما هو الصداع الذي يجب ان تذهب الى المستشفى، او الصداع الذي يحتاج انك انت فقط يريلاكس ولا يحتاج ان تذهب الى المستشفى. كذلك من الامور المهمه اللي تعلمناها في الكويت ان خلال الجائحة بدينا توصيل للأدوية. النظام بالكويت, the rule in Kuwait here, patients should go to the hospital just to collect medication. They go every 2-3 months. And that's not good. If you are dealing with a pandemic, you have to stop doing this, because otherwise you're going to increase the infection. So Ministry of Health with the Ministry of Interior, we start to deliver the medication, the refill medication for the patients. If the case is stable, and many وايد من الحالات, كثير من الحالات, they are very stable. And they don't need to go to the hospital. They just need to fill their medication, especially for many cases with a chronic disease. Going to the hospital at this time is not really that easy. If you don't need to do it, you don't need them to do it. We have to see only urgent cases and cases that need to be seen. Especially we don't know, as you are seeing, I don't know the situation in United Arab Emirates, what's happening also in Kuwait. The cases has been decreased in the past 2 months, but this month again there is an increase in the cases. But inshallah things will improve inshallah soon, bi'idhnillah, everywhere in the world. What we have learned as people who make decision, and the Ministry of Health also, that some of the medication we run out of them. So when you are dealing with very important medication for migraine, not only migraine, في أمور مهمة أكثر for people with hypertension, الناس اللي عندها القلب، الناس اللي عندها high blood pressure, for people with epilepsy, الصرع, people with stroke. You have to have enough storage in the country, because when the country go locked down, you'll have. So at least we started to make decisions and plans actually that important medication. What are the important medication we should have them? And we should have, any country actually should have at least 6 months storage of these medication. Also, doctors, it was very crucial for the doctors to know and to differentiate what is a red flag, what is a headache which is serious, and this patient need to be seen, or this patient need to be admitted to the ward. You know, admitting a patient not easy, because many people, they gonna deal with this patient, and we have to do the PCR, we have to do the test for the coronavirus, like you have to do the COVID-19 test before you admit the patient, and sometimes it takes time. And sometimes take 12 to 14 hours to 12 to 24 hours to get the result of the COVID-19. So it's very important to us actually to differentiate what is hot and cold cases. And the red flags, so you have to look for the red flags. And the red flags, لو كان المريض عنده حرارة and صداع, fever and headache. No, this is not something straight. ممكن عنده meningitis, سحايا. Or the patient has been complaining of headache and weight loss. You have to think of something else. أو headache وطلع له rash. This is something also, maybe something vasculitis. أو إذا أنت قاعد تتعامل مع new headache, صداع جديد, والpatient عنده malignancy, أو الpatient immunocompromised like HIV patient. هذول not straightforward. You have to see them and you may need to admit them. أو headache with confusion أو تغير الوعي أو loss of consciousness. These are serious headache. أو headache new onset, sudden onset. You have to rule out subarachnoid hemorrhage اللي هو النزيف. هذول جدا مهمين. أو new onset صداع جديد في شخص فوق ال 50 سنة. You have to look for giant cell arthritis. You have to rule giant cell arthritis. You may need even to do a biopsy, and you have to treat fast because you prevent visual loss. And also you have to look if there's a change in the pattern. هذا مو صداعي. المريض عنده صداع نصفي صار له 10 سنوات, لكن he's coming. You go, doctor, this is not my headache. I'm having different type of headache. Then you have to take it really also seriously. Now there was a challenge actually looking to the fundus. فحص العيون في المرضى كان a challenge because we wear the face shield or the Google. And these things actually can make the fundoscopy different. So I started actually to get a lot of help from the ophthalmologist. Why سألت أطباء اللي هم أطباء العيون for to check people fundus because I was doubting if I'm really seeing the fundus, and I'm also you're not sure, and you get very close to the patient and you are still not sure. So actually getting an ophthalmologist was very important. One of the challenge أحد التحديات كذلك إن أعراض الكورونا and the migraine. There is an overlap in these things. Headache has been described at least 8%. We are seeing even more and more, not only 8%, and we are seeing it even after the recovery. Even after they recover, they can develop a headache, which is bifrontal usually, and it can last up to 3 months after the infection of the coronavirus. So it was challenging to differentiate between these symptoms. And some of the symptoms like nausea and vomiting and these things, it's actually part of the corona, and they can happen. So we are trying to look for symptoms which are not part of the corona, of the migraine, like shortness of breath, ناس عنده dry cough, fever, dry cough, fatigue, sputum, joint pain. هذه الأعراض لا توجد عند مرضى المايجرين. فهذه الأعراض اللي هي start to differentiate. Are we dealing with a migraine case or we are dealing with a COVID-19 symptoms? One of the also challenge in the patient was actually injection of the botulinum toxin. We stopped the whole country and we were obliged in the botulinum toxin to be closed. And you can imagine actually, I was planning to inject the patient in late March before Ramadan to actually. So people, they went really bad because we couldn't inject them. And it was I was moved personally actually to the COVID team actually. I'm still working in the COVID team, covering part-time for the COVID team and the actual part-time in the hospital. But during that time, most of the people were moved, even clinician, even not your specialty, but you should help people actually. And we were moved to the quarantine station to help the people. And also was a concern, the PPE availability, اللي هي شغلات الحماية, personal protective equipment, like putting the shields and these things and the gloves and the mask. And we cannot overuse them with these patients. Most of these actually were moved to people with COVID team. So it was a challenge, and but we have to put in our mind that migraine patient, المريض اللي عنده صداع نصفي, they can have a severe headache. And when they have a severe headache, that can bring him to the emergency room. And here where they will have a higher risk of an infection compared if they come to a regular clinic. So, but now is actually we are restarted again for the past 2 months, and we are restarting slowly. Also, we are not trying to avoid, because it's very important, really, honestly, to keep the mask and the social distancing between the people. We have to understand this. Most of the people, even in the medical team, when they get infected, they don't get infected in the hospital. They get infected at home or somewhere else, because actually they are not taking the bed. When you are in the hospital, you are taking full protection, wearing mask, washing your hands. But people, they do. It's a small mistake, actually, which make people get infected with coronavirus. So that challenges us, actually, in the past few months. And this, alhamdulillah, got published in the last month. And we did a survey on the people. It was an online survey. And we figured out that about 60% of the people, they got worsened their headache actually صداعهم صار أسوأ. الناس اللي عندها صداع صار أسوأ خلال الكوفيد 19 because they did not get injected for Botox, and their anxiety, they are not having the same routine, and they cannot reach to their doctor. Many of the response, and many of the patients, actually about another 40% of the people, they had used traditional medicine. حجامة، راحوا حق الحجامة والصبغة، الناس تحط special substance in their head, and fish something here they call it الفري. They do actually, they lock the head, so they tight it very tight. People, there are a lot of people, they call it traditional and Arabic medicine, and they keep doing this actually to improve their symptoms. So there was another problem which came actually, I think in France. The problem started in France, and some of the people, I'm not sure if it was the Minister of Health or some, they say that you have a problem with a non-steroidal, especially الايبوبروفين. قالوا في مشكله ولا تستخدمون الايبوبروفين والنون ستيرويدال ممكن تسوء الاعراض. والمشكله, the problem, that WHO also they expressed their concern in this, but soon after this they removed their claim and they retracted this problem because it was only theoretical and it was never clinical. So what we did, we have continued using the non-steroidal and the ARB, because some people think that these are the entry port for the SARS-CoV-2 اللي هو الكورونا فيروس نفسه يدخل عن طريق هذه وقالوا إن لو استخدمت هذه الأدوية ممكن، لكن it was never proven. So everything actually, and even the WHO corrected themselves, and we are continuing using this drug in our patients. Now the challenge also can في status migrainosus, which is a migraine which continues for 72 hours. هذا المريض كان في السابق we admit them quickly to the hospital. Or a patient with a cluster, they need to come to the hospital. They need to have an infusion and this thing. We couldn't do this. We couldn't do them. Cluster headache is like a suicidal headache actually. يعني صداع غير طبيعي. And they knock their head in the walls, and it's very tough. So alternatively, we started to use oral steroid over a few days. Or we have in Kuwait, we have frobatriptan, which is a long-acting triptan. So we can give it over a few days. But many of the cases, actually, we have to bring them to the hospital to treat these cases. Steroid was a challenge. We use steroid in many of our difficult cases. And steroid, actually, we have to use it carefully because it can prolong the replication of the SARS-CoV-2. But if you need to use it, then it can be the only solution in many of the migraine. في وايد حالات تحتاج إلى كورتيزون نحن نعالجها، خاصة صداع المستمر في هذا greater occipital nerve block and these things. But the oral steroid, we need it for tapering dose and also for patients with multiple sclerosis في MS. فكان في always a concern. So when you need it, you have to be careful. But in some of the cases, we needed to use these cases. Now, المونوكلونال اللي هو المتوفر حاليا والمتوفر في الامارات والمتوفر في الكويت هو دواء اسمه ايموفيج ودواء اسمه امجالتي جالكنيزماب and the Eronam. Why? لانهم safe. So they are safe. And I have posted a few videos for the patients and for the people how to administer them so they can use them. The good thing actually, and I was planning to do that in any case even before the coronavirus, because it can help the people during Ramadan. The problem actually that the insurance company, خاصة in Europe and USA, شركات التأمين, they oblige the people that they should use other oral medication, or they should also inject botulinum toxin before they go this. And now they are thinking, actually, هم الآن قاعد يقررون, and there are many papers were written during this pandemic. They are asking the insurance company, you should not put this rule that people, because this is safe, effective, and in the long term, it's very good. And it will bring the people actually time, and it will decrease will improve monoclonal ban. I think it's really a very good opportunity for people to be used in pandemic and to improve the quality of their life and to decrease their visit to the hospital. Now, one of the things we did not think. By the way, I ran out of devices during I used one of them, which is the one on the tier. That's frequently. Maybe because of their not availability, we don't know how to use them, many reasons. But I think devices can be very helpful, and the patient can use them, and they don't need to go anywhere. There are 4 devices approved actually by the FDA now. The most recent one is the REN, based on the REN. It's called Nervio, and this is based on the electrical neuromodulation. They put it on the arm, and it has each device has had like 12 sessions, and each session is 45 minutes. And also the cephaly, or the external trigeminal, based on the supraorbital nerve stimulation, and the single pulse also stimulation, and the vagal nerve stimulation. I never used those 3, Nervio or transcranial or vagal nerve stimulation, but I used actually cephaly. But I ran out of the device actually during the pandemic till now. Now, it is very important for people to stick to the routine and to stay the same as they were before the pandemic. This is important for everyone, and more important to the migraine patient. Migraine, الصداع النصفي يحتاج إلى إنسان to have the same routine all the time. يحافظ على نفس الروتين حتى في الويك-end، حتى during الهذا، to keep the same sleep cycle, to keep the same eating cycle. So if you miss with the migraine, you will have more attacks. And that's what people actually. Now we started to see, قاعد نشوف كثير من الحالات, they have anxiety, they have stress, they have obsessions, they are thinking too much, they feel down, they feel burned out. And that's because of the change in the routine. Many people during the lockdown, they change their routine. They stay late at night, they watch TV, they eat late, they wake up late. They have changed because of either they are working online, or they don't go to the work, and the working time is different. And also lots of people are actually facing difficulty with keeping their work. Now I started to see this in uni actually, that people difficulty to maintain their work because lots of companies, they have bankruptcy. That's also another challenge actually for people they develop. What I want to say, you have to drink plenty of fluid, good hydration, keep the same, and try to exercise and actually do self-meditation and these things. And those are very helpful for the people. Finally, I think I'm facing this personally, actually, first of all. يعني هذه أنا قمت أواجه هذه المشكلة, and there are plenty of people, actually physicians, they are facing this problem. And it's a headache that developed due to external compression. And this is a headache that, I see it even with the people with migraine, they don't like actually to put the mask. And they don't actually put the elastic bands that on that. They prefer, because it can trigger sensation. They feel it's more painful. They have something called allodynia, which is perception of pain for non-painful stimulus. يعني إحساسه بالألم أكثر. اللي عنده صداع نصفي إحساسه بالألم أكثر من الشخص العادي. ما يحب الماسك أو السيور اللي تنحط ورا الأذن الإلاستيك هذيله. أو putting a face shield. Can you imagine doctor putting face shield for many hours? These were actually causing headache for them. So it's something that probably we have to be aware as a physician or people working in the headache field. We have to be aware about such headache that can be developed newly in patient with physician. في صداع جديد قد يظهر عند الأطباء أو من يعمل في الطاقم الطبي, وكذلك قد يظهر also can happen among normal people who wear personal protective equipment, and this has been documented in many of the people. So this is my last slide, and I'm happy to be with you to answer any question. I try to make it not very long, but I'm happy to have any question from the audience or from the chairman of the meeting.
Thank you very much, Dr. Jasem, for the very informative lecture. I mean, I actually learned a couple of things myself during this presentation. So as you had said, I mean, I think a lot of countries were not prepared for the COVID pandemic. And as you said, whether it was the use of PPE, having the availabilities of personal protection equipment, or having medication available, or even how do we see patients? A lot of places were not ready, or they had the infrastructure, but they just never used it, and it was never tested. So what do you think as we're starting to see the second wave and maybe third wave? How do you think it'll be different this time?
You see, now the country is prepared, at least in a better way. We cannot. Well, I'm not talking only about the headache now, but because I have been working with the country for a while now in the COVID team. And so, when this actually happened, we ran out even of masks. There are no enough masks. And so لازم توفر كمامs for the people. Like, how come you ask me for, as a medical people, to work and you're not giving me full equipment to protect even myself? And you have to also to provide it for the people. And how to convince the people they don't need to go to the hospital. It was a new thing that we started, actually, the Ministry of Health deliver medication for the people. Please stop coming to the hospital. Plus the panic, when the pandemic happened, people, they panicked. We had the hospital in the first few days of the pandemic. The hospital was full. People, they were afraid that they would run out of medicine for the next 6. So they want to take medicine as much as they can, and they have. And that was a challenge also. Who should take medication? And you cannot give everyone until we get enough supply. So second,
I think the connection is. Oh, you're breaking up, Dr. Jasem.
I think.
Hello?
Dr. Jasem, your line is breaking up.
Do you hear me, Gerard?
Yes, we hear you now, yes.
Yeah.
Thank you.
The connection broke up a little bit, but now we have you back.
Hopefully it's not going to go far, and hopefully we will have a vaccine soon.
Inshallah. Another thing, when you were talking about headaches in the age of COVID, is the post-COVID headache or the COVID headache, is it similar to migraines or is it different? Like, how do they present?
So there was a study which was done in Spain. So the study was done in Spain, and they looked for people who are developing headache after the COVID-19. And many of the patients, actually, so migraine patients, they can have their migraine exacerbated. يعني اللي عنده صداع نصفي ممكن يزيد خلال الكوفيد. But there are people who develop de novo, like a new types of headache after the coronavirus. الحين he recovered. They recovered from the COVID-19. They recovered from the coronavirus, but they still complain of the headache. And most of their headache was actually in the bifrontal region. So most of their headache, they have it like bifrontal region, and it can goes up to 1 to 3 months in those people. So it's not unexpected إن راح يجيلك العيادة مرضى they complain of a headache ما كان عندهم, they never had such type of a headache, and they have it on a daily basis. They can have it, and some of them يعني لو if they meet the criteria we're gonna call it new daily persistent type headache لأن مع الوقت بس هذا secondary to the infection. We call it secondary to the COVID. So it can go, and usually it's bifrontal, and it can go up to 3 months actually in some of the patients.
I see. And actually, you had mentioned a new type of headache, and actually, I think I suffer from that, the external compression headache. You got on one hand the need to wear the mask for your own protection, but on the other hand, it causes me a headache. So it's a balance, and I think most healthcare workers have to figure out that balance.
Right. So, and you can imagine this is more with migraine, huh? The migraine patient, they have something they have called allodynia. هي أساساً those ladies, they don't like earrings, they don't like watches, they don't put هذا tight, even they hate to make يعني شو يسمونه ponytail هذا because they let their hair harder, because migraine is very sensitive. So you can imagine putting them more sensitivity on these things. Actually, it can cause more tension on those patients. But we have to reassure the people. There was many people who came in the social media telling the people that using the mask is bad, actually, and came actually from Western country, not from the East country, and it will increase CO2. And that's wrong. So wearing the mask never will cause a problem. And there has been just recently, I think it was in John Hopkins, or they did a study and they looked actually for people for the tidal volume of the CO2. They looked to the CO2, the CO2, and there is nothing actually. You can imagine surgeon, Jarrahin, they go for surgery every day and they wear masks actually for long hours. They never had a problem actually. So mask thing, but it's really annoying, I think.
That's true. We can welcome back Gerard, because I'm sure there are questions in the audience that would love to ask Dr. Jasem his opinion.
Yes. Thank you very much, Dr. Jasem, for a very nice talk. And we've had quite a few questions, both on the public chat and some private questions as well. So I will just go ahead and just begin to ask your opinion on these questions. Question here is, COVID affects my mental health and lockdown affected my headaches. It was very hard to deal with. What advice do you give me for next time if it happens?
You see, I think, first of all, you have to accept the situation. And we have to accept, all of us, we should accept the situation. And you are not the only one in this boat. We should accept this. We should not say, why me? Why? No, it's everybody is facing this. Even doctors, don't think we are angels and we are not under stress. We, all of us, under stress. But what we are trying to do, we are trying actually that's what I'm doing in my house even, and with my children. It's a new life. Who thought that all kids, they will learn online and these things and everybody staying home? So, but it is very important that we keep the same routine. We should not change our life. If you just keep watching TV and watching Netflix tons of hours, that will ruin your life. But what you have to do, you have to keep the sleep cycle the same. You have to sleep on the same time, wake up on the same time, eat on the same time, and then try to do what you was doing before. At this time, you're gonna need exercise more than before. Don't watch your phone or the social media at night where you want, that's the time where you want to go to sleep. Because many people, they spend a lot of time checking their WhatsApp or going in the Instagram or the Snapchat. And when the light is dim and it's a dark room, that's the time to relax. Do not stimulate your brain at that time. So try to do, there are tons of free applications in the Android or in the Apple store. There are free applications. You can train yourself. You can play Pilates. You can do even as little as 15 minutes per day if you do these things. It's a habit. And we have to accept the situation, and we have to stay optimistic actually. So my advice, most of the people actually who got down, those people actually who change their routine. Those actually who change their routine a lot, that's where they have a problem. Do not change your routine, and drink plenty of fluid, and try to eat on a regular basis.
Thank you. Actually, I have a question, Dr. Jasem.
Sure.
You had mentioned that one of the issues during COVID was the availability of medications, and now we have a newer class of medications where you only need to take once a month.
Right.
And you were saying that this has been shown to be safe. Have you seen a difference in availability, that it's easier to take care of patients who suffer from migraines, given that they only need to see you now once a month, as opposed to someone who needs to come and get medication regularly?
Oh, definitely, Dr. Ahmed. I think these monoclonal are miracles. Actually, they are very good. You know, and I know, the only problem with these medications, they are costly.
Yeah.
They are very expensive. Whether you put them on the country, or you put them on insurance, or you put them on the people. They are expensive medication. but otherwise they're very good. We know that they are very good. We know that they work beautifully, but they are expensive. So if you, what أنا لو تيجي تقول لي, if a patient come and bring himself to me and he tell me, doctor, I have frequent migraine, but I'm able to pay for myself, then my choice will, especially during that time, my first choice will be those monoclonal. You have to go on monoclonal. Please sit down. I'm going to teach you how you do this. Please do not come to, you can just send me a message or send me an email if you are okay. And the pharmacy will deliver the medication to you at home. You don't need to come and sit in the waiting room with many sick people. And we don't know who, how many of the cases actually went for a place and they don't have any problem. And all of those people who were in this room, they got infected because there was an asymptomatic case, an index case. So we know it's tough for many people, but I think we should do what we have to do now. يعني الأماكن, we should not go to places where we don't need, يعني ما في urgency. We have to try to go for things where we really need to do them.
Thank you very much.
Thank you, Dr. Jasem. Another question here about telemedicine. Do you think it will continue to be popular or grow, or do you think it will fall away after COVID dies down?
That's a perfect question. You see, I'm sure there are also physicians watching this. It's it has two parts, this thing. Okay, let me start initially what I felt about it, then what I felt lately about it. So I think telemedicine, we have learned a lot, and people who should study now, they should do IT better than they study. Because these people, they can run the world from their own home. And you see, I have seen major conferences through my screen. And previously, since I'm a doctor for the past 20 years, I have to attend conferences like at the East or the West Coast or somewhere in this world, and you have to go on the plane and these things. Now you can do it. It's possible. It's plausible, and it's efficient even. I find it very efficient, and it's quick. But this is not probably what many countries they want, because conferences is a source of money for hotels, airlines, doctors, companies. But that's something. But it was really, and they are all free. The meetings, they are virtual and they are free or very minimal, and they still have their sponsor. It was really very good for many doctors. I learned personally, initially, and I think we can do many of. And actually, I stayed to. I never did a video call with patients. I found it very efficient. 10 minutes, 5. It's actually shorter in time, efficient, no problem. And I can do it actually, rather than I was working in the morning, actually even in the evening, they schedule an evening call and I speak from home with the patient. So it was really. Where is the problem, I think now? I think it's overused. That's my thinking, and probably Dr. Ahmed, he knows. I think there are the companies now and these things, they keep bombarding doctors actually. Too many webinars. I hardly have a day without a webinar. Can you imagine? Now, you know what happened to doctors? They burned out. You know why they burned out? Because they are afraid they are missing a webinar and too many people attending. I'm not attending. I'm a poor man, but I am actually burned out. I have attended the whole week actually a webinar. You have webinars. Sometimes you have 2-3 webinars per day. Yeah. Can you imagine? So I think now, when I do a conference in Kuwait, international conference, I do it every 2 years, biannual. And the first thing actually, when I try to choose the date, I look for a date where I'm far from all the dates of conferences. Now, if these webinars, they all cluster at the same time, I think they're gonna burn out the doctors. Initially, I like them, but actually, I think they should be like, I don't know, there should be a place where these webinars should be controlled, and they divide them on times, and they give them time, and they should, for example, we cannot do, for example, epilepsy like 10 times in October. We're gonna know about, no, haram. We cannot do epilepsy we have to divide them. I'm really serious. If people keep doing this, without controlling the knowledge for neurology. We have to learn and peace and what is important and these things. Otherwise, but telemedicine is very good. It proved that we can do many things through online. It saves time. There are people who cross 100 or 150 kilometers عشان يشوف الدكتور Ahmed Shatila. But he can make a video call and he can finish this. He doesn't need to see Ahmed Shatila about this. So we learned that yes, it's possible, it's doable, and the insurance. لو أنتم مثلا, I don't know the system in Arabia or في هذا, of the insurance company should accept and the people, they can make a video call and you can chat them the same way. The insurance company لازم تجي. The insurance company should come and sit down and they should know that the world has changed and we should accept things. Well, and my still we have to do 1, 2, 3, 4. No, we're gonna do 1, 2, and then we're gonna jump to 5. But because of this pandemic, it's very important we learn this during this pandemic.
So thank you. You mentioned stress and headaches, and that you need to balance your life. And I think one of the issues that sometimes parents face is the whole online learning for their children. I have parents now telling me the whole online education, their kids at home is causing extra headaches for them. So as I tell them, there's the medication and then there's the quality of life. And medicines can only help you so much, but you still need, as you said, maintain your hobbies, maintain a routine, and you got to have a system in place. Is that correct, Dr. Jasem?
Yes, actually it's correct. It's what we call this, maybe we should call it life adjustment. We have to adjust our life. It's like, when a lady gets newly married and it's a new life for her. So she has to adjust also, and the man enter a new life. We entered, I think, in a new life where too many people. Now I see my kids, all of them, they are on the online. And they are actually, and everyone say, please do not shout, and he's in his room, do not shout, I'm not listening, and these things, please. So it's a new life. Now, we have to take the advantage also of this, and I have to take it. Now, we don't know how much is very effective with kids, but maybe it's doable. Now, we are a challenge now. We just finished, I'm doing the final year exam in the Faculty of Medicine now. And to examine like 120 students, we are late. We are trying to finish the previous year still, and we did not finish. So we are trying to finish like this October, and we have to start in the middle of November. It's a new life. It's going to be adjusted. But we have to take the advantage. How we take the advantage? Before, for example, you need to take your kids every morning, and you have to wake them up. You dress them up, and you have to bring them. You have to leave to work, and you bring them from school to your home, and these things. That's also time. It's easier now. It's much easier. They wake up, they can do it themselves. They will learn. Maybe they will find, everyone will find a difficulty, Victor. Who knows Zoom or these webinars and these things that I initially, I don't know what is these things, but I learn. It's a learning curve, and everybody can learn. We're gonna learn them with time. It can save us time, and we have to take their advantage. We have to take their advantage. Before, we had a risk car accident, you have to get a driver, you have to get many people to take your kids, bring your kids. Now they can study at home. Now how efficient is this? We cannot. But we have to know that many people also, they were learning. They were using this type of learning, the distance learning or the online learning. And they were very efficient. And it was very efficient. The online even will improve.
True.
And we have to stay optimistic. لازم we have to stay optimistic. It's very important إني أنا لكل مريض, for each patient I tell them, please stay optimistic. If you are healthy and you are safe and you are living in peace, that's a bliss. You cannot take it until you have your own food, you are drinking water and these things. There are many people, they are not afford to have such things. You have always to think that you are blessed and you are on the positive side. Do not think of the negative side of the story.
Okay.
Thank you, Dr. Jasem. Very, very nice answers to these questions. I'll continue with some more questions here on the chat bar. Are we at a higher risk of COVID as migraine patients?
No, As simple as this. You are not at higher risk at all. No, you are not at higher. You are not at lower. Not at higher. No. You are just as same as any other person. And but some of the actually people with migraine, they have bronchial asthma. We know that migraine patients, they have bronchial asthma. Even though bronchial asthma itself per se does not put you at higher risk to get COVID-19. But if you get the COVID-19, your symptoms can get worse if you are bronchial asthma. But even if you are a bronchial asthma without migraine, but migraine, they have an overlap between bronchial asthma and migraine.
Thank you. Is only candesartan or other sartans may also reduce migraine symptoms?
Only candesartan. In studies, in good studies, actually only candesartan, which has been shown, which is equivalent to a 160 milligram of propanolol inderal. You can imagine 16 milligram of candesartan, level etacan, can be as effective as 160 or 180 milligram of propanolol. So it's only candesartan. I'm not using any other ARB or the angiotensin receptor blockers because we do not. Some of the people, they use them, but the evidence, I don't have any evidence on them. So I keep only using candesartan when I need in a patient with migraine, and I think it's a very effective advice.
Thank you.
What may be the cause of headaches in the acute stage and long COVID stage?
Say that again. I'm afraid.
Sure. What may be the cause of headache in the acute stage and the long COVID stage?
That's a very interesting question, I think one of the good people who spoke about this is Dr. Patricia from Spain. And there is a lot of cytokine which are released actually during the acute phase of the COVID-19. And one of them actually which has been implicated is the interleukin-6. So interleukin IL-6 is actually one of the things actually which has been thought about is actually which increased. And that's why there is a drug which is rheumatologists, they have been using. Some of the people think that it can be helpful for people with corona. I think it's called tocilizumab or something like this, actually, interleukin, monoclonal, something. And so it could be due to the increase in the inflammatory reaction, particularly speaking interleukin-6, that can inflame. Now, in the long run, maybe it's the consequences of this, or it's due to the sensory area in the brain. Because, initially people, they thought this is only a disease which affects only the lung. We thought only the disease affects the lung. But just after a month or two, we knew actually that this can reach to the brain and can cause even meningitis or thrombosis or stroke or anything in the body. So the setting and the trigeminal nucleus caudalis, it can get affected in those patients actually because of the cytokines storm and these things. And it needs to be reset. It takes time to wash out actually these symptoms. You can be, they do the masha or PCR for you and it's negative. But people, they still have the cough. So the symptoms of the coronavirus and the fatigue, you can look for the fatigue and how much they get fatigue. It can go up after to 1 to 2 months post symptoms actually. So it's a disease, weird, I have to say, strange. We don't know much about this and we keep learning new things about it. But I think it does not end by doing PCR and which is negative. I think it takes some time for the lung, for the heart to recover, and for the body to recover from the COVID-19.
Thank you very much. I think the next question is kind of a comment that kind of goes with what you were saying, that this person said that COVID affects hair fall and weakness even 5 months after. So you do get post-infection sequelae that can last and linger for months after the initial infection.
Yeah, I think these are things, and there has been many studies which are done. They did an MRI on the heart, they did an MRI on the lung on many patients. They think it's actually, even after a few months, those people, they still have some even consequences after the COVID-19 infection.
Thank you.
The concern using ibuprofen for patients infected with COVID-19 is, should we still be cautious about this?
I'm not cautious. I think that actually we are using them. The WHO put a comment, and just after a few days, actually, since there was no evidence, they just throw it back. So I'm using ibuprofen, and I'm using non-steroidal in patients with migraine. I think I don't have any solid evidence. We don't have till now, and you see, and it has been since like few months. This has been withdrawn, and it's never came back again. It's very important in the they never come, because if they don't show back again, so that means it's negative. It's totally negative. So nobody actually, it has been studied and it's negative. It's not part of the COVID-19. Actually, some of the people, they claim it's good. Actually, some of the people say the non-steroidal, because if you work on the receptor where the coronavirus entry with this medication, you may prevent even the entry of the virus. So it's never been either white or black. So whenever you need to use them, I think you can use them.
Thank you. We have a question here. For how long in the month can we use triptans for migraineurs? And is there a difference for chronic migraineurs?
You see, there is no difference between, the rules stay the same rule between episodic migraine and the chronic migraine. So the rule is actually the maximum is 10 days per month. That's the maximum, because otherwise the patient will go on something called medication overuse headache. So they should not use more than 10 days. And for simplicity, I usually tell the patient you cannot use more than 2 days per week, because I know that they will go higher than this, because I will make them to the lower side. And within a day, they can go maximum 2. So I tell the patient, actually, you have to take 1 and wait. The majority, they will improve from the first triptan. If after 1 or 1.5 hours they don't improve, they need to take another triptan. And that's it for this 24 hours. They cannot do more than 2.
Thank you very much, Dr. Jasem. I do not see any more questions. Gerard, do you see any?
No, I think we covered all the questions that were wonderfully put to Dr. Jasem and equally wonderfully answered by him. So if I may just take 1 minute to just give a final announcement. Just bear with me here 1 minute. Thank you again to Dr. Jasem for this great talk. We have our final headache session next week. This is on headache and women's health with Dr. Suzanne Nouri. This will be the final one in the patient headache series, so please join us for Monday, the 26th of October at 7 p.m. UAE time. And also, Dr. Shatila has launched his website, which is posting all these webinars free of charge to the public. So we have the first wave of MS, pain and dementia webinars up there free of charge, so please feel free to visit his website. It's not fully completed, but it is functioning, so he's excited to welcome you all to his wonderful websites.
I would like to congratulate you on such events in a very nice, different way, hitting public. Well done. Good, very nice job, actually. Different way of doing other webinars.
Thank you, Dr. Jasem. It means a lot. Thank you. So,
and thank you, Gerard, and Dr. Shatila.
Thank you, Dr. So, Dr. Ahmed, do you have any final closing comments for the webinar?
Well, I would like to leave the floor to Dr. Jasem before I say my final comments. Is there anything you would like to say?
No, thank you so much. And for the people who are listening, guys, whether you are doctor or you have to keep the same routine. يجب أن تعرفون, if you speak Arabic and English, you are not the only one in this. Everybody is facing the same. Always look to the other side of the coin. You are blessed. You eat. You are safe. There's no war happening. You close your door. You sleep. Nothing. So these are many, alhamdulillah, good things. You have available mask. You have you have to keep it. It's tough time. Yes. Try to keep the same routine. Same routine. Sleep same time. Please do not switch your timing of sleep. and try to reduce your screen time as much. Don't watch screen time, and to sleep, the eating better. You have to set a good model for your kids. You cannot ask your kids to be good if you are not setting a good example for them. And after years, to come to tell them why you are doing this, we have to set a good model for them. Allah يحفظ الجميع. May Allah protect you all.
Thank
and
you.
stay safe.
So with that, I would like to thank Dr. Jasem for the very informative, interesting lecture tonight. I would like to thank our sponsor, Lily, for making this event possible. I'd like to thank the host, SSMC, for allowing this webinar to occur, and finally Gerard from Focus Golf for organizing this event. With this, as-salama, thank you, and inshallah we'll see you next time.
Thank you. Thank you. Dr. Jasem, finally, how can somebody find you on Instagram to get more information from you? What is your details?
I just, where I can, I put it in one of my slides.
Oh, no problem. If you send it to, I will send it in the email to all the delegates post-event with the recording. You will all receive your recording 1 hour after this event, and I will put Dr. Jasem's Instagram details on that email. So you will see that.
I'll email it to you, Gerard.
Sure. Thank you, Doctor. Yes, email it to me, please. Yes.
Thank you.
Thank you all. Good night. Bye-bye.
Bye.